Welcome to our anterior tooth dental anatomy marathon. This week we're going to be going over the 6 anterior teeth, and today we're starting with the maxillary central incisor. Hi, I'm Dr. Clara. I'm a practicing dentist and your new dental study coach. I'm taking mountains of textbooks and information and turning them into short, easily digestible videos to make studying in dental school a little bit easier. Speaking of studying, are you currently studying for a tooth identification test? Be sure to steal my 5-step tooth identification cheat sheet in the description below. There are 2 maxillary central incisors, the right and the left, and those are numbered 8 and 9 using the universal numbering system. The maxillary central incisor is one of 4 types of incisors. And like all incisors, it has an incisal edge and no cusp. The maxillary central incisor is located at either side of the midline, so that the right maxillary central incisor and the left maxillary central incisor contact each other at the mesial. The maxillary central incisor has the largest crown of all the incisors.
Attention dental students, when studying for your dental anatomy tests, be aware of descriptions like largest, longest, most, least, and smallest. These extremes make great test questions. For example, true or false, the maxillary central incisor has the largest crown of all the anterior teeth. True.
The function of this tooth is the same as all incisors: to cut, bite, and shear food, support the lips, help with aesthetics, and help with speech. The maxillary central incisor erupts at ages 7 to 8 years old, and the root completes 3 years later at 10 years old. The initial sign of calcification is at 3 to 4 months. Let's look at the maxillary central incisor from the facial. The crown is generally shaped like a trapezoid, with the larger base at the incisal ridge and the narrower base at the cervix, so that the tooth tapers from the incisal ridge to the cervix. This tooth is taller incisal cervically than it is mesial distally, though sometimes they can be a bit more similar and the crown may be square-shaped. The average height of a maxillary central incisor crown is 11 millimeters, and the maxillary central incisor is the widest mesial distally of all the anterior teeth. This tooth has an incisal ridge and not a cusp, so the incisal outline of this tooth is straight, with a slight sloping towards the distal. If the tooth is newly erupted or not in function, there may be 3 bumps to the incisal ridge called mamelons, and these can represent the 3 facial lobes of development. The middle mamelon is the smallest of the 3. The mesial outline of the tooth is slightly convex, slightly curved, and the mesial incisal angle is a right angle and quite sharp. The height of contour or contact is in the incisal 1/3. The distal outline is more convex than the mesial. The distal incisal angle is more curved and more obtuse than the mesial incisal angle. The distal contact or height of contour is more cervical than the mesial, being located at the junction of the middle and incisal thirds. The labial surface of this tooth is convex, though some can be quite flat in the mesial and incisal thirds. There are 2 developmental depressions, the mesial labial developmental depression and the distal labial developmental depression, which divide the 3 facial developmental lobes. The root of the maxillary central incisor is cone-shaped, straight, with a blunted apex. The root is longer than the crown. Now let's flip this tooth over and look at the lingual. The outline of the maxillary central incisor from the lingual is the same as it was from the facial, just reversed. What differs is that the lingual surface is not as smooth or regular as the facial surface was. There's going to be a depression called the lingual fossa, and that lingual fossa is going to be outlined on all 4 sides. Mesially by the mesial marginal ridge, distally by a distal marginal ridge, incisally by the lingual aspect of the incisal ridge or the lingual incisal edge. And then it's going to be bordered cervically by the cingulum. And the cingulum is going to be displaced to the distal on the maxillary central incisor.
Attention dental students, another popular type of test question is knowing the borders of things. In this case, the borders of the lingual fossa could be a great test question. The 4 borders are the mesial marginal ridge, the distal marginal ridge, the cingulum, and the lingual portion of the incisal ridge or the lingual incisal edge, not the labio-incisal edge. A test question could show up as, which of the following structures is not considered a border of the lingual fossa of the maxillary central incisor? The distal cusp ridge.
The distal marginal ridge and the mesial marginal ridge are going to just blend into that cingulum. And there may be a developmental groove from the cingulum to the fossa. The root and crown of this tooth are going to taper lingually so that the mesial distal dimensions of the facial are wider than the mesial distal dimensions of the lingual. It's going to be a little bit easier to see from the incisal view. Let's take a look at the mesial and distal first. Let's look at the maxillary central incisor from the proximal view. This is the mesial, this is the distal. The crown of the maxillary central incisor is triangular or wedge-shaped, with the base at the cervix and the apex at the incisal ridge. The facial outline is convex from the cervical line to the height of contour, and then slightly convex from that height of contour to the incisal ridge. The height of contour is located in the cervical 1/3. The lingual outline is S-shaped, convex from the cervical line over the cingulum, and then concave to the incisal ridge. The height of contour is in that cervical 1/3 at the cingulum. The cervical line, or the CEJ, where the root of the tooth and the crown of the tooth meet, have a curve towards the incisal. That curve is more pronounced on the mesial aspect than it is on the distal aspect. In fact, the mesial curvature of the CEJ of the maxillary central incisor is the most pronounced of all of the teeth. It can go 1/4 of the crown or more.
Attention dental students. Once again, remember to pay attention to extreme descriptions like largest, longest, most, least, and smallest. This is another great example of a popular one that is tested on. Remember, the incisal curvature of the cervical line is most pronounced on the mesial of the maxillary central incisor. This can be worded on a test in a few ways. Some examples. The CEJ curvature is greatest on the mesial surface of which tooth? The maxillary central incisor. True or false? The curvature of the cervical line is greatest on the mesial compared to the distal. And the curvature of the cervical line is the greatest on the mesial of the maxillary central incisor compared to all the other teeth. True.
The incisal ridge of the maxillary central incisor is centered over the root of the tooth. Another way of saying that is that a line through the center of the tooth will bisect the apex of the root and the incisal ridge of the crown. If the maxillary central incisor has wear from use or incising food against the lower incisors, there may be wear facets. A wear facet is just a shiny, flat, polished area. For maxillary incisors with wear facets, those facets are going to have a lingual inclination and be located lingual to the surface of the incisal ridge, matching where those teeth typically rub against or incise against the mandibular incisors. The root from this view, still cone-shaped, still straight, still has a blunted apex. Now let's look at the maxillary central incisor from the incisal aspect. From this view, the crown is triangle-shaped. And you can see that tapering I was talking about when we were looking from the lingual view. The crown is tapering from the broad facial to the lingual where the cingulum is. The maxillary central incisor is wider mesial distally than it is facial lingually, and it is the widest mesial distally at the incisal ridge. You can see the mesial marginal ridge and the distal marginal ridge joining the cingulum, and that cingulum is displaced to the distal. The maxillary central incisor has one root, and that one root has one canal. A cross-section of the maxillary central incisor at the cervix makes the shape of a rounded triangle.
Attention dental students. This is another popular topic that could be asked a few ways. The thing to remember is that a cross-section of the maxillary central incisor root and pulp, especially in newly erupted teeth, are triangular shaped at the cervical line. At the cervical line, a cross-section of the maxillary central incisor would show a triangular shape. Which of the following cross-sections are of a typical maxillary central incisor? This would be C, the one that is looking like a rounded triangle shape.
So we've been going over the typical features of a typical maxillary central incisor. But no two people are the same, no two maxillary central incisors are going to be the same. There's going to be some variation. Common variations for a maxillary central incisor are having an unusually short root or an unusually long crown. Another variation of maxillary central incisors is having exaggerated marginal ridges with a very deep lingual fossa, giving the tooth a shovel-shaped appearance. This shovel-shaped variation is actually genetically determined. It's seen in Mongoloid races, including North and South American Indians. And that's it. If you found this video helpful, it would really help me if you gave it a like. Be sure to subscribe because tomorrow we're going to be going over the maxillary lateral incisor. Till then, you can check out this playlist of dental anatomy videos. Happy studying! Bye!